And so my perspective here is how it works clinically. Is it worth the cost? Can I fit it into clinic? Does it make some kind of money? Is it good for patients? That's my perspective with ultrasound. Not academic, but clinical. Case, 23-year-old nurse snowboarding in New Hampshire, injures ankle, urgent care diagnosis, lateral ankle sprain, nothing on x-ray. She comes home, I take more x-rays, nothing on x-ray, but she has pain with palpation at the malleolus and the lateral talus. Happened to be, I read an article 1 week before she came in, and I wish they all worked this way, about snowboarder's injury and lateral talar process fracture. Right? 1 week I get a patient that comes in. I wish, again, they all work that way. So what special imaging would you order? Yeah, and I agree. MRI CT makes perfect sense. Okay. Snowboard injury, typical ankle sprain, negative radiographs in over 50% of cases. You got your types, which we won't get into. It's a compression type of injury. It affects different structures, different joints. But the key here is, what can the ultrasound do for us? There's our probe placement. And anatomically, you look for bony landmarks, right? So with this probe placement, you're going to see the malleolus, bone number 1. You're going to see the talus, bone number 2. And you're going to see the calcaneus. So that should be in your image. This slide's manipulated so you can see it in regards to anatomy. But here we have our lateral malleolus. We have our talus, which is in 2 pieces. And we have our calcaneus. And that is a fracture. A very efficient scan, again, less than 3 minutes. And with documentation, you have your template, you fill in the gaps with the template. That should be quick too. So this should not be taking too much time in the clinic. This is my picture. This is not manipulated. This is how you would see it on the ultrasound. There's our lateral malleolus. Here's our talus. Here's our fragment piece right here, and calcaneus is down here. So I only read this 1 week prior, so I'm thinking, am I actually seeing this? Right? So I get an MRI, and that's what it was.